My name is Katy Kozhimannil. I use she, her pronouns. I'm a professor at the University of Minnesota School of Public Health, and I'm also the director of the University of Minnesota Rural Health Research Center. I have fancy titles, but at the heart, I'm a person who loves and cares about kindness and justice, and I love connecting people with their own power. Because of that, I'm so very honored to be recognized by the National Rural Health Association with the 2022 Educator of the Year Award. I am so honored. I grew up in rural and tribal lands in Minnesota and North Dakota, and one of the things that's the most important to me is to help legislators understand the consequences of their decisions for people who are often not at the table when those decisions are being made. Often these are the voices that are unrepresented, but they're also the people that are most affected. One of the passions that I have in my teaching is helping people to articulate the effects of policy decisions on their own communities. I love having a chance to connect people with the skills that they need to advocate for their communities in health policy and beyond.
Katy is among the most committed and passionate people I have ever met, and her concern for rural people and places is infectious. As a professor at the University of Minnesota School of Public Health, she encourages students and mentees to think about the ways in which the issues they care about might play out uniquely in rural communities. Katy developed and teaches a health policy course, which serves as a core course for students in the Public Health Administration and Policy Masters in Public Health program at the University of Minnesota. In that course, Katy encourages her students to actively engage in the policy process, including reaching out to their legislators and writing op-eds for local, regional, and national outlets. Katy has also been instrumental in establishing a rural health equity postdoctoral fellowship here at the University of Minnesota, as well as Project REACH, a program that trains rural community leaders in Minnesota to engage in policy at the local and state levels with the goal of improving rural health. In all of these efforts, she keeps her focus on health equity for rural residents at the center of her work, and her students and mentees have all benefited enormously from her guidance and passion.
I so admire the intention Katie puts into creating a rigorous experience for her students. Her lectures and the Principles of Health Policy course inspired me to think critically about the environment surrounding health policy decisions with passion. The course assignments were applicable to the work we intend to do in the field and super useful. As a research assistant with Katie, I can also say that these qualities extend beyond the classroom. She is compassionate towards her colleagues, understanding, and committed to advancing health equity through research.
As a former student and current colleague of Katie's, I know what a dedicated educator she is. Katie has a passion for teaching that is apparent not only in each classroom she enters, but also through her work in mentoring students and supporting them through their studies and future endeavors. Through the hundreds of students that Katie has taught in the past decade, she has made such an impact with the students who bring their health policy skills to a variety of fields and positions, targeting real change in health policy across levels of government. I can't think of another educator who is more committed to instilling policy and rural health awareness and passion among students. Congratulations, Katie.
Katy is a great educator inside and outside of the classroom. I have learned so many things from her, but three key things especially. Firstly, Katy teaches me to employ, cherish, and lead with my identities as a Black woman with a migrant story. Secondly, Katy teaches me not to distill emotions out of the policy making process because command of my righteous anger is an important tool for change. Lastly, Katy teaches me the importance of the team. I'm reminded by her that it is not necessary to walk alone, not professionally nor personally. She is a connector and a believer in others, reminding me that my contributions are both unique and a part of a greater collection of people working towards a more equitable and healthier future for all. I am so thankful for her courses, of course, but I am most thankful for her courage, her accessibility, and her centering of those most vulnerable within our society.
As a former student and teaching assistant for Katy, I can confidently say she is hands down one of the best teachers I've ever had. She brings an incredible passion and energy to her health policy class at the University of Minnesota. As part of her class, Katy teaches a really smart framework that she developed for how to communicate with policymakers. This framework is something I use in my job every day and has provided me with the tools to effectively engage with policymakers in my personal life. Not only is Katy a truly exceptional teacher, she also deeply cares about her students. She takes the time to get to know her students, but most importantly, she is there for them. When I took her class, my mom suddenly passed away. Katy was so supportive and understanding, and that meant the world to me. I feel very lucky to have had her as a teacher.
Thank you again. I am so honored to receive this award. I am incredibly proud of being able to connect students and community leaders with their skills so that they can use their voices and their expertise to really make an impact in the communities that they call home. Thank you so much.